Hello everyone, it's Dr. Taiba, and in this video you will learn how to measure the urinary bladder on ultrasound. The bladder measurements are preferably taken with a full bladder. After locating the bladder in a transverse plane, you can measure its height and width. To measure the height or the interior posterior measurement, place one caliper at the inferior wall of the bladder and the second caliper at its posterior wall, and you will get the height. After that, you can measure the width of the bladder. Place one caliper at the bladder wall in this manner and the other caliper at its opposite side, and you will get the width of the bladder. This will be the transverse view. Next, you can switch to a longitudinal plane to measure the length of the bladder. Place one caliper at the bladder dome, the superior aspect of the bladder, and the second caliper at its base in this way, and you will obtain the length of the bladder. After you have gotten the length, width, and height of the bladder, you can calculate the bladder volume using the ellipsoid formula. Bladder volume equals to length into width into height into 0.52. Here are some general measurements of the bladder. These are the usual values obtained amongst different age groups. These are just estimated values. In a neonate, the full bladder volume can be between 30 to 40 milliliters. In a 1-year-old, it can be between 50 to 100. As you can see, this range gradually increases as the age group increases. Between ages 10 to 12 years, the volume can be between 250 to 300 milliliters. For 13 to 15 years of age, it can be between 300 to 400 milliliters. And finally, for the 16 to 18 years age group, it can be between 400 to 500 milliliters. In some adults, the maximum bladder volume can also be 600 milliliters, so these can vary among different age group. These are all full bladder volume. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.